So it's been almost a year since the start of the pandemic, and we would like to hear from you today about what you've learned to NWIS from providing data and technology in a crisis, through your response to support the NHS, not only to work remotely and securely, but to help them manage their response to fighting COVID. So what we're interested in is the challenges that you've faced, the new solutions that you've brought in, and finally, what you've learned and how from the pandemic and how your approaches have evolved.
I'm Carwyn Lloyd-Jones. I'm Director of ICT at NWIS, so I run a number of the infrastructure teams, cybersecurity and our primary care services. So if I start, because I think probably where the pandemic hit first was probably for the need for people to be able to work remotely. And this became clear before sort of, the formal lockdown happened last March. It was obvious that we were going to see, and we were seeing more and more people connecting to our various remote access services. And, to give you an idea of scale, back then, we had about 800 users a day, right? A peak of about 800 concurrent users that were using our VPN solution across Wales. And, on the occasional snow day or whatever, it would peak to sort of 1,500, maybe 2,000. Now we're at somewhere between 7,000 and 8,000 most days. So we had to very, very quickly scale that up, buy additional hardware and licenses and these kinds of things. And that became a challenge because the rest of the world was doing exactly the same as us. They wanted to increase their capability. So we did a lot of work working with the suppliers. But I think it's also one thing that worked really well was we worked across the public sector. So we loaned some equipment that happened to have been bought by schools. And so they loaned us some equipment that helped whilst the other equipment was being shipped to us from the various manufacturers. So, so first on, as in there was the VPN remote working capacity. Then we had GPs. So we had a particular challenge with GPs because most GPs didn't have laptops. There are, a small number of laptops, but compared to the sort of 10,000 desktops that there are in GP practices, because GPs typically worked in an environment, where the patient came to see them. And so we had to very quickly look for a solution, and we grew on a technology that we were already using in the organization for remote support purposes. And we worked with that supplier and rapidly bought some additional capability for that and put a solution in place that would allow GPs to use any computer, whether it was their own one or a work one, to remotely control their work computer, because that had the ability then to print prescriptions. So there was lots of work done to that. Also then linked to this kind of remote working was Office 365. Now we had a reasonably big deployment of Office 365 in NHS Wales before. So I think at the start of the pandemic, we probably had around 15,000 users actively using Office 365. So it was, most of the GPs and their practice staff, which would be about 11 to 12,000. There was NWIS, the Shared Services Partnership, Health Education and Improvement Wales, and Welsh Ambulance. We've been using it for a few years. And we were just on the journey of adding extra NHS Wales organisations onto it. So we were at 15,000. Now we're at over 100,000. So the scale of adoption has been quite phenomenal, really. And we've used a number of third parties to help us do that. We wouldn't have been able to do it ourselves. We've got third parties in helping us technically, helping us with project support. And that really has made a big difference. It also turned out that some of the underpinning infrastructure has been very useful for other elements. So Azure Active Directory is an underpinning technology for Office 365, but that's also used by the contact tracing solution. So so where we'd invested and time and money in other stacks of technology helped with other bits then. And I think Teams was the initial priority for us to roll out. I think like most organizations across the world were looking at Teams or Zoom or something similar to help them. So there was that. And then Attend Anywhere was the product that was bought for allowing GPs and others to offer remote consultations. So we kind of rapidly deployed that as well. And then, of course, in that, we suddenly saw a massive increase in our internet usage on our internet connectivity. So we are now using about 6 times the bandwidth that we were about a year ago. And it's still increasing as we onboard more and more organizations and features onto Office 365 and the video consultation services. And I think it's probably fair to say that we would have really struggled if we didn't have the PSPA services helping us. We get our connectivity both within NHS Wales and to the outside world from the PSPA team in Welsh Government and BT, and they really helped us when we needed to scale up rapidly. I think one of the things, of course, that we had to maintain, and we sent out some very early messages, was that security is still important. Whilst everyone was desperate to get more information, more access from anywhere, we knew that the kind of the bad actors across the world were seeing this as a great opportunity to attack NHS Wales. So we've had to put quite a lot of focus and made some early rules that said, you can compromise on a number of things, but you can't compromise on security. And I think that was one of the big ones. I think it feels as if it's never ending. That's my other reflection. So I've mentioned, we started off with remote working, remote consultation. And then shortly after that for us came the priority system for testing the key workers. So this was the time before, wide scale testing was available. And then the wide scale testing became available, and we suddenly see a significant number of increase in tests and test results that are being processed every day. And the number of people that want to be able to see those test results and the statistics around those test results. And then contact tracing, of course, came along shortly after that. So that was another thing that required a significant increase in bandwidth and compute power and whatever. And then, more recently, it's been vaccine. And even I don't know what will come next. It's difficult to predict. It might be something to do with passports, vaccine, holiday passports for COVID or whatever it is. So it's been very, very busy, and I think the point is the rest of the work doesn't stop. So we've had some other significant activities that have been going on. So we're right in the middle of planning for a move from one of our data centers to a new location. So that has had to happen in the middle of COVID, and then our laboratory information system had to be upgraded because it was going end of support. By the manufacturer, and they couldn't offer us an extended support offering. So we had to replace the system that is processing, almost all of the test results in the middle of doing all of these increased tests. And then we've also, some other big things that we've done is to roll out a new pharmacy system into several new hospitals. And there are lots of other examples of things that we've done that are having to carry on anyway. So it's been very busy. I think we're going to do the kind of reflections and the lessons learned at the end. So I'll probably stop there, and I'm going to hand over to Rachel. Yeah.
Thank you, Carwyn. I'm Rachel Powell. I'm the Deputy Director of Information at NWIS. I actually joined NWIS in September 2020, midway through the pandemic, to head up the Information Services Directorate. So my team's already fully involved in the COVID response. And I think from my perspective, it's been a case of trying to catch up with all of those commitments and definitely jumping in feet first and trying to keep abreast of everything, to be honest. Just to say a little bit about the Information Department, which is a core function of NWIS, we effectively act as the central information department for NHS Wales. We've got responsibility for the collection, storage, analysis of mandated all Wales data flows, for costing, performance management, official statistics and service improvement purposes. So as I say, we're quite a core function of NWIS currently pre-pandemic. I think for us, our COVID response and how we've really embedded ourselves throughout the COVID response, it's been really critical to us as a team, and it's really put us into the the lights, if you like, but it's really highlighted the importance of what we do. And I think everyone would probably agree the imperative of having data and intelligence throughout the pandemic has been really important. So I think my teams and the necessity to come forward and organise ourselves in such a way that we could really provide the need for, or provide the data as it was requested, that's where we've really had to organise ourselves around the COVID response. We also appreciated that data and intelligence, specifically in respect to COVID-19, multiple organisations were going to call upon us to monitor the outbreak of the disease and the impact on their services. So one of the first things that we set about doing at the start of the pandemic was determining what data we already had access to and what we'd need to obtain and how we could obtain it quickly. And I think there's probably a key point there. I think the way that we've operated throughout the pandemic sometimes hasn't always been the way we would do things longer term, or, you know, our reflections and perhaps approaches that we're trying to refine as we go ahead. Sometimes we've just had to do things quickly, and it's been a really best efforts type approach to get things as quickly as possible so that we can respond as safely as possible to the need out in the service. The COVID Data Hub then specifically, that was born out of the requirement for data and intelligence, and it's essentially a dashboard which presents the key COVID intelligence to operational teams and key partners to help them manage the COVID response in NHS Wales. The COVID dashboard, it's constantly developing, and whilst we established it and set it up early on in the pandemic, it's something that we've been refining and developing throughout. And it typically, you know, it shows the prevalence of COVID and the impact on services, mortality information, and then obviously more recently the COVID vaccine activity information, which has been really, really important and a key tool, the COVID Data Hub, and trying to manage that activity operationally and seeing how services flex and respond to that need. We're refreshing the Data Hub at 3-hourly intervals throughout the day, which again, it kind of signals the demand and the need for that information. We're always being asked to give updated figures, to add more developments. And I think for us, it's really been a case of people want more access to information, and we're just trying to keep abreast of all of that, the requests really that are coming to us. And I think the COVID Data Hub tool has really proved its worth in terms of, you know, making that information accessible as soon as possible, and as live as you know, really reflects the activity on the ground, so to speak. It's also made us think about, it's highlighted for us some important issues with regards to data quality. So where we work really closely with services, and we've got some key colleagues out in NHS Wales that we're really in close contact with. I think the COVID Data Hub and how we're reporting on the information our end, it probably highlights some issues with regards to how the services are recording that activity, and where we can refine and improve those data collection processes and data capture points earlier on, so that the reporting that we're doing really is reflective of what's happening in the services as well. And I think for us that's probably working with services to really, you know, report what's going on. That's been quite a key joint achievement action. It's given us a bit of a work plan going forward, if you like. I think the governance issues as well around the Data Hub and all of the data acquisition and reporting that we're involved with, that's been really, really important. And I think my information services teams work really closely with Darren Lloyd and his information governance colleagues, and actually they've been quite embedded in the discussions and the developments going forward.
Well, thanks Carwyn, Rachel, Darren and Claire for sharing with us your data and technology responses and perspectives at NWIS in terms of help fight the COVID pandemic. So just to conclude now, with a future focus, what would you say are the top 2 takeaways of what you've learned over the last 12 months to take forward?
The 2 takeaways, as in, I think first of all is that having single sort of national systems has given us enormous flexibility to doing things at scale and also quickly. You know, there are disadvantages to having single national systems. You know, when they go wrong, everyone's affected, everyone knows about it, but they do provide you with a lot of benefits as well. And we can talk about, we've talked about the laboratory system that we've got, the results repositories, we're able to share the data, make data available to others. The immunization system that we've got has been a development from a child health system that we already had, that had a concept of immunization in it already. Office 365 is another good example, and sometimes doing things at scale can be slower, but it's usually, if you've got, there'll be one organization that can do it faster if they were doing it themselves, but you will get 12 organizations or whatever across through the end line faster if you do it once than if you let 12 people do it themselves. And I think that's probably been one of the big learning things for me. I think the other bit has been around cooperation across the organizations, both within the NHS, with local government, with Welsh Government as well, of course, but also with suppliers. I think that having good relationships with key suppliers is really important. You never know when you might need something unusual, like this, like COVID, or something urgent. And we've had much more success with suppliers where we have good regular engagement than when we've had suppliers where we don't have that, and even if these are sort of, multinational companies or whatever, those that we have a good working relationship with, regular meetings and stuff like that, has helped us. As people probably know, at the start we had suppliers almost falling over each other offering us services, and it was very difficult to try and work out which ones you were going to try and do something with and which ones you're going to say thank you, but thanks for the offer, but we'll think about it and we'll come back if we can use you for something. But those that worked well are those where we had those existing relationships. So I think they're probably the two things for me. Rachel?
Yeah, I mentioned it when I was speaking earlier, but I think data quality for me, that's something that's, in our world, it's resounding all the time. It peppers everything that we do, to be honest. So it's the COVID response wasn't a surprise in terms of that data quality for us. We'll probably flush out a few issues. But I think it's, I would like to emphasize the good working relationships that we've got with a lot of partner organisations throughout NHS Wales, and we've had that common shared purpose working towards the COVID goals. So I think that's been really useful in trying to tackle some of those issues jointly. But I think, just really appreciating, we are the data hub, the primary care information portal, all those tools, they're shop windows, if you like, to what's really going on behind the scenes. And I think for us, if we could flush some of that out and really have a really concerted effort working towards that in the future, that would be really, really important going forward. I think the second issue or learning reflection from my perspective is around the competing priorities in some respects. And I think just appreciating the limited capacity within what teams, and this is even limited to COVID. And I mean, it's not reflecting the other work that we were also contributing to throughout the pandemic, because whilst we did switch off as much as we could, other things don't stop in health. You've got to keep things ticking over. But I think even in respect of COVID, it wasn't just the data hub, for example. My team were also involved in the shielded patient list, trying to help identify clinically, extremely clinically vulnerable patients, the mortality reporting, a lot of work that went on there, the COVID data hub developments, the primary care information portal developments, all of the data requirements that went in the vaccination system. So there was an awful lot of COVID specific work, but different types of COVID work that the team were contributing to. And I think just capacity in with the team, hats off. I think people have worked over and above the expected contractual hours to deliver what needed to be done. But I think going forward, we really appreciate the importance of data and information. And I think hopefully it's given a bit of a bit of insight into how important that is, particularly in relation to the pandemic response, but more broadly, and building capacity within those types of teams. I think is going to be really important going forward for NHS Wales, essentially.
Okay, well, thank you, Carwyn, Rachel, Darren and Claire, for sharing with us your COVID learning on data and technology in a crisis.
Thank you.
Thank you.
Thank you.